As a conscientious provider, you, your assistant, and substitutes will want to continue to strengthen your base of knowledge in order to provide the best care to children. Health and safety training is required of you, the main caregiver and provider. You will need to take this health and safety course prior to obtaining your license or registration. If you submit an application and get your training during the application process, the health and safety training can count toward the 15 hours of training you are required to take in the first 6 months of the licensing period. Once you complete the first 15 hours in the first 6 months, you can work on taking an additional 15 hours over the next year and a half. A total of 30 hours of training, covering 9 topic areas, is required of providers every 2 years. Assistants are also required to complete 30 hours of training in the 9 topic areas every 2 years, and 15 of those training hours are required within their first 6 months of employment with your program. Substitutes are not required to complete training, but it is your responsibility to orient them to all aspects of your program. The added exposure to new topics will help keep you current in areas so important to your care of children. Training topics must include principles of childhood development, including appropriate supervision of children, meeting needs of children with physical or emotional challenges, and behavior management and discipline. Nutrition and health needs of children. Child daycare program development. Safety and security procedures, including communication between parents and staff. Business record maintenance and management. Child abuse and maltreatment identification and prevention, statutes and regulations pertaining to child daycare, statutes and regulations pertaining to child abuse and maltreatment, and education and information on the identification, diagnosis, and prevention of shaken baby syndrome. Because training is a critical piece of your professional development, verification of it is required and must be submitted to your Office of Children and Family Services Registrar. To help you track your training, OCFS provides a useful tool. This form is available on the OCFS website. We explained that health and safety training is required, but what's covered in this mandatory training? The required health and safety training is the most basic of trainings, developed to make you aware of circumstances and issues which have a direct impact on the health and safety of children in your home and surrounding environment. It will give you a base of knowledge to prevent the spread of disease, illness, and accidents. This information is very practical and addresses things that come up on a daily basis while caring for the children. You can find out more by going to the Professional Development Program's website. There, you can also find a certified health and safety trainer in your area, or contact your local child care resource and referral program. First aid and CPR are other important training requirements to consider. Training in this area is available to child care providers. Some is free, some isn't. To find out more information about the cost of first aid and CPR training, contact the individual training organization. These resources will also be available at the end of this video.